Hello, my name is Dr. Raymund Tanaka. I'm a restorative practice dentist here in Glendale, Arizona. And Pat Lacey wanted me to share with you some thoughts regarding dental office laboratory communication. So other than the lab form that typically accompanies an impression material, the communication type just starts there. Sometimes we have to discuss the best type of material in a different situation, such as if it's an anterior tooth, with a high aesthetic value, we talk about what would be the best situation for strength and also for aesthetics. And also in a posterior section, also with a first molar versus a second molar, they do require different types of materials also, and so Pat and I would talk about that also. Secondly, also is the shade. As you can see from this picture on this monitor here, we take pictures of a shade guide tab in the person's mouth, and we'll either make a hard copy or we'll send an email, digital, of this picture here. That's very important as far as office communication with the laboratory. Another thing is that when we're talking over the phone, there are sometimes patients' desires, such as the size, certain position in the mouth, the way they want or how they perceive aesthetics, and so they may have certain requirements that they would like to have in their design of their restoration that we probably would not have taken into account. So we actually have to talk about what the patient's desire is. Shape, size, form, they have their own ideas of what they want their tooth to look like, and definitely we have to take that into consideration. Last thing that we also talk about, we also have to talk there's a critique form that we have here, and I'll have Pat show this here. It basically is a communication between our chair side and the laboratory that we talked to Pat about, and it shows the restoration that is being delivered. If there is anything that needs to be improved on for future restorations, we have these forms filled out so that Pat will understand that we like our contact a little looser, a little tighter, occlusion a little higher, a little less, and margins and everything about it, emergence profile, everything is filled out in this form that we can talk about, so that working over a period of time, when you start working with a laboratory initially, there's a lot of learning between us and them, and so once you start working with each other for a period of time, then they'll know exactly what you want, and it makes future restorations so much easier.